women are facing pressure to work more hours, and for many, it's taking a toll on our mental health. Some say they see no rest in sight. That's the topic of this week's Wellness Wednesday with Dr. Natalie Gentile of Direct Care Physicians of Pittsburgh. I'm so glad that you're here to talk about this because especially this time of year, it seems everything is really piling on, but this is an all year long issue, really.
It is. This is becoming one of my new favorite topics because I'm working on setting boundaries.
It's a big one. Look at that word. Watch out. She's in town. So let's talk about some of these key stats because I think this will speak to a lot of people at home too. 1 in 5 women say they don't have time to see a medical professional about their mental health. This goes back to something that you're very passionate about too, and that's having a connection with your patients to make sure that you're checking in with them, that they know they can check in with you.
Oh yeah, and I mean, I see it in a lot of ways. I own 3 businesses, I'm a mom of 2 littles, right? And I'm a physician, and being, having gone through that training where our mental health as physicians was not addressed.
Right.
I'm gonna say it again, it was not addressed, right?
Yeah.
It's not, the resources aren't even really available. And on top of that, you can, there's a lot of stigma around it.
Right.
You could get flack for seeking help as a physician.
As a physician.
Yeah.
And I think that's true in a lot of positions, but I'm glad that you brought that up too, because I don't think that we see our doctors in that way. We think, you guys are okay, you're in health, you must have it handled. But it's important to also recognize that every single profession has their things. You're very busy, right?
Yes, and it's hard to seek help for yourself, right? And it's hard to make time to prioritize that.
So how do you do that? You said you have 3 businesses, you have 2 kids. I know they're young. So how do you make that work for you? I
wasn't making it work for a while, so I'm going to be very honest with that. One thing that I'm really working on lately is trying to define what my currency is. I'll elaborate. We spend money, that's our currency, right? In exchange for something else. What is your currency? Either it's your expertise, your time, it could be financial giving, but what is something that you're giving of yourself and that people are wanting from you? How can you allot that currency appropriately?
I know for a lot of people, it's just the time.
Yes.
And there's just not enough of it. There's only 24 hours in the day, and you got to fit some sleep in there at some point.
Yes, exactly.
1 in 4 women also say they experience unmanageable levels of stress and anxiety as a result of their job. I wonder too, are these normal levels of asks being made of women, or is it because we feel responsible for so much more between home and work?
100% the latter,
yeah.
Right? It's really what we are responsible for and what we are expected to do. And I think because of that general maternal instinct, and we are viewed as the ones who will always be giving of ourselves in our society, it's not going to change.
So let's talk about some of the ways that we can change this. And you said think about your currency as one of them. I want to talk about emotional labor too, and we're going to talk about this a little bit later in the show as well. But women tend to fall as the house manager. I call myself the house manager. While my husband helps with a lot of the tasks at home, there's still all of the other stuff that needs taken care of. Why do you think that is, and how can we change that?
I think women, and this is a big generalization, we are better at multitasking.
Yes.
We're better at seeing kind of the big picture, juggling a bunch of things at one time, whereas men in the household tend to be really good at one thing at a time, and thank God we have balances of those types of personalities, right? But then we become the household managers because we're managing so many things at once, whether it's kids, events that are coming up, or even like what's on the menu for the week.
Oh, and we were just talking about this week. If your kids are still in school this week, you got Grinch Day and Pajama Day and holiday parties, and they need this, and then get the gifts to the teachers.
Yeah, you're lucky if you're getting lunch this week.
That's right. What's on the lunch menu? Forget it. Number 1, though, one of your suggestions is make the appointment with your PCP. Don't put it off. If this is a New Year's resolution for you, call now and make that appointment.
Yes, I just did that and established with a PCP, and I am a PCP.
Yeah.
Right? Like, you need to establish care with somebody who you can offload onto and get some help for the things that you need. Stop trying to take care of everything yourself.
And share the load with your partners. Also,
communication is key.
Self-care. I think this is a big area I know I struggle in personally because there's so much going on that at the end of the day, I find the free time that I have, I'm taking care of the things that I can without the kids and the rest of the family around. But how do you set boundaries so that you can have self-care?
A lot of it is communicating that need. I need this time set aside for myself. And saying that to the people around you. I'll tell you what, I've been shocked now that I've been vocalizing my boundaries to patients, colleagues, my family. You get back actually like a good vibe. People want you to be okay.
Do it. Yes. And this I think is so important. We were talking in the commercial break about just saying no. And you said, I'm going to send you a good podcast. And I said, I'll listen to it when I have time. You said, well, you could just say no and just don't listen to it. But saying no to things to not add to your plate. is so important too.
It is. You're just not going to be able to give all you can with your full passion, with your full, stamina if you're spreading yourself too thin.
I think too, and I hope that this is changing, but there's this fear as a woman that if we say no or if we put up these boundaries, that it is in turn going to look like we're not a nice person or we're not this polite and sweet young lady that we should be. And for some reason, it drives us to just say yes and do more and be there for more people.
I'll tell you what, when I say yes to too much, I'm not so polite and sweet anymore.
Right. Somebody gets the brunt of it.
Yes, exactly.
So saying no, setting those boundaries, and make the appointment with your doctor.
Please.
It's all so important. I'm glad that we could talk about this, and I do want to listen to the podcast.
Someday, or you could say no.
Just say no. Hey, if you're interested in making that doctor's appointment with Direct Care Physicians of Pittsburgh or checking out Rebel Wellness, we're going to have a link to both at our website, kdka.com/talkpittsburgh.